This is Lee. She plays sports, likes the outdoors, and loves spending time with family. Lee wants to live a long and happy life, doing the things she loves. But too many of Lee's friends and neighbors have had their lives cut short by non-communicable diseases like cancer, heart disease, and diabetes. And Lee is surrounded by things that increase her risk of getting sick. Every day, Lee is bombarded with ads for cigarettes and alcohol. The shelves in the local supermarket are filled with salty foods and sugary foods and drinks that are more affordable than healthier options. And it can be hard to tell which foods are actually healthy. Lee knows it's important to exercise, but there are no safe cycle paths in her neighborhood, and sometimes the air she breathes makes her cough. Lee's also worried about what happens if she does get sick. What if she can't afford to pay for treatment? What if she loses her job because she needs time off to recover? Non-communicable diseases cause 7 out of every 10 deaths worldwide and stop millions of people from enjoying healthy and prosperous lives. They also cause huge social and economic problems, putting extra pressure on countries that have limited resources. Thankfully, governments and organizations are working on solutions. One of the most effective and affordable options is the law. Laws influence all aspects of our lives. They shape how we work, shop, eat, and visit our doctor. And in doing so, they can reduce our chances of getting sick, dying, or having our lives turned upside down by a chronic disease. In Lee's case, her government can pass laws that protect her family from deceptive alcohol and cigarette marketing, raise the price of cigarettes, alcohol, and sugary drinks to make them less appealing, and make companies selling unhealthy products give Lee the information she needs to access healthier options. Laws can stop industry from polluting the air Lee breathes and create safe spaces for her to stay active. And if Lee does get sick, laws can give her access to safe, effective, and affordable healthcare and make sure she's protected from discrimination and unfair treatment. Laws can be very effective, but a lot goes into making them work well. That's why the McCabe Centre for Law and Cancer works with governments and other organizations to advance laws and regulations that prevent cancer and other non-communicable diseases and protect people affected by them. By researching new legal developments and sharing knowledge through world-class training and technical support, the McCabe Centre helps develop, implement, and defend laws that empower Lee, her family, and her entire country to live happier, healthier lives.
Well, welcome everyone. Thanks for joining us today for this virtual dialogue celebrating the 10-year anniversary of the McCabe Centre for Law and Cancer. I hope that as you join, you were able to catch this introductory video, giving you a little bit of the flavor of what the McCabe does and the area of work and the topic we'll be tackling today. My name is Alessandro Di Capua. I'm the Senior Manager in Capacity Building at UICC. I'm just going to do a very, very quick welcome and logistics before diving into the sessions today. So let me quickly just share the screen once again and to share what we're going to go through today. So actually, before sharing the screen, so today I'll soon pass the word to Dr. Christy Graham, the Director of Capacity Building, for a few words of introduction. Just so you know, this is in a meeting, so you're able to switch on your video if your connections allow. Please stay muted. There will be some interaction during the sessions today, so just keep your microphone muted unless you're speaking, and do use the chat to start filing in questions as the conversation goes. We will be using today Mentimeter, which to poll the audience on a few questions. So have your smartphone or computer handy. We'll provide you a code and there will be a few questions for you. But without any further ado, let me just pass the word to my colleague, Kirsty Graham, Director of the Capacity Building Team.
Hi everyone, good morning, good afternoon, good evening. It's lovely to be with you today, and it's fantastic to be hosting this virtual dialogue with the McCabe Centre for Law and Cancer, and specifically celebrating the 10th anniversary year of the McCabe Centre. Now, for those of you who are not familiar with the McCabe Centre, it is a sister organisation of UICC. It was established in 2012 by UICC, Cancer Council Australia and Cancer Council Victoria. And it's really the only centre of its kind in the world advancing law to prevent cancer and to protect people affected by it. And that short video that you saw just gave an illustration of what this really means, and hopefully gave you a little bit more context if you're not familiar with the work. Now, I'm really excited to see how the discussion evolves today. And it will showcase kind of a few success stories and experiences from the McCabe Centre over the last 10 years. But I think it's also important to note that the McCabe Centre in its last 10 years has also become a WHO collaborating centre for law and non-communicable diseases, and also a knowledge hub for legal challenges to the implementation of the WHO Framework Convention for Tobacco Control, which I personally think are two significant achievements and really recognise the work of the McCabe Centre. Now, today, the discussion and the virtual dialogue will be moderated by Hayley, and it's my pleasure to introduce her. Hayley Jones is the director of the McCabe Centre, and yes, over to you, Hayley, for the rest of the dialogue.
Thank you so much, Kirsty and Alessandro. It's been an absolute pleasure working with UICC on this and on so many other things. Before I begin, I would like to acknowledge the traditional custodians of the lands that I'm speaking to you from today in Naarm, in Melbourne, Australia, the Boon Wurrung people of the Kulin Nation, and pay my respects to their elders past, present and emerging. And I would also like to acknowledge any Aboriginal or Torres Strait Islander or First Nations people who are joining us today. Here in Australia, it's NAIDOC Week, which is a time where we celebrate the history, culture and achievements of Aboriginal and Torres Strait Islander peoples. And this year's theme is Get Up, Stand Up, Show Up. And it encourages all of us to champion institutional, structural, collaborative and cooperative change while celebrating those who have already driven change and led change in Aboriginal and Torres Strait Islander communities over generations. The McCabe Centre is really proud to be a joint initiative of three wonderful change-making organisations in health: Cancer Council Victoria, the Union for International Cancer Control and Cancer Council Australia. And at Cancer Council, we know that Aboriginal and Torres Strait Islander people's health is everyone's responsibility. There is much more work that remains to be done, but I'm really pleased that all of our organisations are working so actively to close the care gaps so that everyone can enjoy the highest attainable standard of health. As Kirsty mentioned, the McCabe Centre was launched back in 2012 as the only centre of its kind in the world, and we continue to make a global impact today, shaping laws that prevent cancer and protect people affected by it. If I could have the next slide, thanks, Alessandro. We've celebrated a lot of firsts over the last decade. Kirsty's mentioned a couple of them, and we've got a little slide that shows some of those, some of the other milestones that we've celebrated where we've made an impact for people with cancer and other chronic diseases around the world. And I would really like to acknowledge the incredible contribution of the McCabe Centre's founding director, Associate Professor Jonathan Lieberman. Jonathan has such wonderful vision and foresight in establishing the McCabe Centre and in shaping our mission to promote the effective use of law for the prevention and control of cancer and other non-communicable diseases by building knowledge, expertise, capacity and networks at global, regional and domestic levels. So a big thank you to Jonathan for all of his efforts over so many years. Next slide, thanks Alessandro. So our activities have changed over time and adapted as we have to changing circumstances. And core amongst these has been our extensive training programs, which have aimed to build capacity amongst government lawyers and policymakers from low and middle income countries to use law to prevent and control cancer and other NCDs. And this work has included helping strengthen the ability of officials to identify gaps in their laws, to help reduce the risk of cancer, or to defend and strengthen laws. And we've also worked with civil society to draw on evidence in their advocacy for health promoting laws. And in recent times, we've really successfully transitioned these activities into online courses. This has built a really strong network of McCabe Centre alumni who are working to use law to address cancer in their own countries. And I'm so pleased that we're hearing from alumni today. We're a source of knowledge about law and NCDs. We conduct legal research, contribute to publications, we share best practices, we assist WHO and member states in reducing the cancer burden as our work as a WHO collaborating centre, and we assist Cancer Council with legal advice and submissions on dealing with regulators. Next slide. Our work is broadly in 10 priority areas, broadly divided into prevention and treatment and supportive care. And our prevention work focuses on cancer risk factors, including tobacco control, alcohol control, unhealthy diets, air risk factor regulation, and the intersection with trade and investment law. And our treatment and supportive care focus areas include access to treatment, including costs of cancer and universal health coverage, health information and health services, and health and human rights in a broad range of areas. And all of this work is guided by the UN Sustainable Development Goals. Next slide. So after 10 years and training more than 270 alumni from 77 countries, we are seeing some of the transformative impact of our work. There are more than 22 countries where alumni have helped to pass health promoting laws, and 7 countries where alumni have helped to defeat the tobacco industry in court, and sometimes multiple times. In Australia, we've published major reports funded by the Victorian Legal Services Board on making the law work better for people affected by cancer. And we've also worked to strengthen the Victorian Health Complaints Framework and worked with the Victorian Health Complaints Commissioner on fake cancer cures. And talking about our impact, this map shows just some of the impact which our alumni have had around the world. Last year, our alumni have successfully defended tobacco control laws from legal challenges in Kenya, Uganda, and Malaysia, passed new tobacco control laws and regulations in Samoa, Uganda, and Niue, developed e-cigarette regulations in the Philippines, adopted comprehensive alcohol control laws in Vietnam, and started the process for a sugar-sweetened beverage tax in the Solomon Islands. And these achievements and many more are outlined in our 10-year impact report, where we've tried to shine a spotlight on the many people who join us in our mission. This includes the alumni of our training programs who apply what they learnt to change laws in their countries, the civil society partners who unite communities to take action, and the people affected by cancer who bravely stand up for their rights for safe and effective healthcare. So we're thrilled to be joined by so many people today to discuss this topic of using law for cancer prevention and control. And given the interest in this topic, we know that the future looks bright for more action. And we have a really fantastic panel that I will now turn to and ask to introduce themselves. So I think we have a slide that sets out our fantastic panel. So we're hoping that we have all 4. We've had a few connection issues, but I might start by asking Dr. Amit Yadav. Amit, could you please introduce yourself and explain your connection to the McCabe Centre?
Yeah, thank you, Dr. Haley, for inviting me for this very important meeting, and it's really a pleasure to be part of this journey, and as we celebrate 10 years of McCabe Centre. I knew Jonathan Lieberman from my association with the Framework Convention Alliance. First met him in 2007 at COP, Conference of Parties of the WHO FCTC in Bangkok. And I think this was also a discussion as part of the Convention Secretariat to develop knowledge hubs, and this center works as the knowledge hub on legal issues with the Convention Secretariat. So it's a great pleasure to be part of this. My name is Dr. Amit Yadav, and I'm working with the International Union Against Tuberculosis and Lung Diseases. This is a Paris-based organization, but I'm working for the regional office at the Southeast Asia in Delhi, and I work as senior technical advisor. I have learned a lot on tobacco control and also using how to use law, when we are talking about NCD prevention and control, and all of those are risk factor for cancers. And we have been using those learnings and experiences shared from the McCabe Centre, and especially the Australian experience on plain packaging and other regulatory efforts on food labeling and tobacco control in our Indian context also. Have been working in my work with FCA and other colleagues. So I've been also working with other international organizations where we have, or other country partners where we have shared this knowledge and tried to build that connection, and especially with the McCabe gave a very important platform for all of us to interact in as an alumni also, and we share our work together and share our developments progress, both individually and also at the group. Now, I also attended the alumni workshop that happened in 2018. So it was again another great learning and meeting opportunity for us. So I'm looking forward to this conversation and dialogue. Thank you so much.
Thank you so much, Amit. And I think we've now been joined by Vicky Worry from Papua New Guinea. Vicky, could I ask you to briefly introduce yourself and your connection to the McCabe Centre?
Hi everyone. Good afternoon. It's now 5:30 in PNG, 5:46. Sorry. I have been one of those participant or the trainee in 2015 together with Dr. Amit and Evita. We were the same batch that passed out in the McCabe Centre in 2015. And during that time as a health professional, I have learned a lot about the laws involved in addressing NCDs in the country. And then I attended the alumni in 2018 back in Melbourne. So I have been like in touch with the McCabe lawyers, especially Dai in the Pacific, who is stationed at Fiji Suva. So I am the program manager for non-communicable disease with the National Department of Health in Papua New Guinea. And my role is basically looking at development, providing technical advice on development of policies, laws, and regulation on laws that try to address non-communicable diseases and cancers. And one of the things that I have been working very heavily with is the tobacco control law and the regulation. And thank you. And it is my pleasure to be part of the panel, and I'm looking forward to more of the discussion during this session. Thank you.
Thank you, Vicky. And I'm so glad we were able to connect with you this evening. And now I'd like to ask Dr. William Onzivu from the WHO Regional Office for Africa. Dr. Onzivu, could you please introduce yourself and explain your work with the McCabe Centre? Looks like we might have a connection issue there. So we'll try to come back to Dr. Onzivu shortly. But in the meantime, I'll ask my wonderful colleague, Evita Ricafort, to please introduce herself.
Hello, everyone. I'm Evita Ricafort, the Regional Manager for Asia of the McCabe Centre for Law and Cancer. I'm saying hello from Manila, Philippines, where I am based. I am the lead for the Asia component of the McCabe Centre's capacity building program, and also the first point of contact for all of the alumni from the Asia region of our international legal training program. And really just happy to be having this, it's sort of a reunion for us, because as Vicky had mentioned, Vicky, Amit, and I belong to that same 2015 cohort of the McCabe Centre's 2015 training program. Before I joined the McCabe Centre in 2015, I was actually the legal consultant of the Department of Health of the Philippines for tobacco control. Shortly after that role with the tobacco control, I joined the McCabe Centre. So very pleased to be having this. And we really did not plan this at all. It was just a fluke that all of us got to be on this same panel. And I'm also happy to see some of our alumni who are present here. We have alumni and some from Nepal, and some participants of our training program. So I see on present in this call. So happy to be with everyone today.
Wonderful. Thank you so much, Evita. I'll just do one more check to see if Dr. Onzivu is on the line. If you are, please introduce yourself.
Yes, sorry about that. My line dropped again, but yes, it's I'm Dr. William Onjivu. I am a technical staff, technical officer, but the legal lead within the cluster of universal health coverage, healthier populations at the regional office in Africa. A lot of the legal work is really focused at the moment on NCD risk factors, but it's increasing work, of course, on environment and health and health systems. A lot of it happens in our cluster. And the other clusters, whenever there's a legal need, they refer them to me, and I collaborate, of course, with our colleagues in headquarters. I think it's been a few years, probably over 6 years now, that we've been collaborating with the McCabe Centre. And it started with our lead visiting McCabe Centre, and since then we have supported, sponsored some staff, and even provided technical assistance wherever it's needed, follow up with the alumni who participate in McCabe Centre. So we've been really keen, and we really appreciate very much the work of McCabe Centre, because we definitely have a big legal need up to date. I mean, the gaps are still there, and I think McCabe Centre really helped to fill quite a big gap, and there's obviously much more work to do in this area. Before my present responsibility, I actually worked for close to 9 years as a legal officer in Geneva in the headquarters when the Framework Convention was being negotiated. But I also worked on some other environmental treaties, the POPs and others for the WHO as well. And for now, we really country focused. We support countries, and a lot of the need emanates from the countries, and we respond to that. Thank you very much.
Thank you, William. I'm so glad we're able to reconnect with you. Okay, so I might now pose some questions to our fantastic panelists, and I'll start with Amit. Could you explain more about what's been a key learning from the McCabe Centre's training, and how you've applied that in your efforts to progress cancer prevention and control?
Yeah, thank you again. I think that's a very good way to start this discussion. I know, as I said, I think when we were first part of this training in 2014, I think I joined, there was a WHO training in December 2014. And WHO supported me to be part of that training. And that is where the Australia had already implemented plain packaging. And that experience was being shared with other countries, while it was also facing the challenge at the arbitration, interstate arbitration and investor state arbitration, and also the later on with the WTO. So we learned a lot. I think the people who were responsible for defending and helping with the plain packaging in Australia, they were part of the panel. We were able to discuss with them how they defended it and what were the legal challenges, and one can do that. And I think based on those learnings, we started small discussions in India, and I did my PhD was also based around that, tobacco and trade, and public health, tobacco and trade. So that helped me both personally in terms of in my PhD work, and also helping in India with the civil society organization and other partners to talk about plain packaging, while also talking about larger pictorial health warnings. And in 2016, India adopted the larger pictorial health warnings, which now cover 85% on the both side of the pack. Earlier, it used to be only 40% on the one side. So that helped a lot in terms of making legal arguments of increasing pictorial warning and putting a plain packaging. So that, I think, was one of the important learnings from the McCabe. And another thing that we have seen in terms of using law for public health is we see a lot of tobacco industry interference. And I think this is true for wherever we look at a commercial angle on any product, any consumer product. So it is true for alcohol, it is true for food products, that you see the industry interference in regulatory mechanisms and the voluntary part of their regulations. Because whenever you try to regulate the industry, they will come back and say that we are we have a we have a non-profit organization part of it, or whatever, as a group, and we want to regulate ourselves as a business people, and that has no meaning, because voluntarily they do not regulate well, and they go to the not even the minimum standards of regulations are adopted by the industry. And when you start regulating by law, which we have seen in tobacco control, then they oppose every law through various constitutional and other challenges that they bring out, livelihood issues and farmers, and even illicit trade. So they bring actually every other possible arguments to oppose the law. But again, through our understanding, or through our training at the McCabe, and I was actually fortunate to get to McCabe in Melbourne 3 times. So I was part of the 2015 cohort as well, and then in the 2018 alumni workshop as well. And so that strengthened our resolve in terms of legal support for advancing public health. We also tried to, after taking cues from the McCabe Centre and also some colleagues in the Melbourne University Law Department, and we thought that we should also talk to the lawyers and law schools in India, so that they talk about public health issues, and they bring knowledge of young lawyers, and when they are becoming lawyers, they can talk about it. So we have been even after joining the union and in my previous responsibilities as well, I've been working with the law schools so that they could contribute more in the legal process. So that has been another, in terms of creating institutions. I've been supporting the national government and the state government on developing various smaller notifications, regulations, so that we can advance public health issues. I'm not getting into specific legalities of that, but then these are the things that we have done. One example that I would want to give is about, which is very recent, and that's about tobacco vendor licensing. So this is something that in India has been pioneering, that and I think this is already in some other countries, but on a larger scale, we have been trying to do that. All tobacco sellers who want to sell tobacco, they must take a vendor license. Currently, you can sell tobacco at any place. So anyone and everyone who wants to sell tobacco can start selling it anywhere. So after getting this license, they will have to take an administrative permission to sell tobacco, and they would have to sell exclusive tobacco shop. And they will have, one of the conditions of the license would be that they comply with the tobacco control laws, including our Indian Cigarette and Other Tobacco Products Act. Juvenile Justice Act in India prevents sale of giving of tobacco to any person who is below the age of 18 years. And the penalties under the Juvenile Justice Act are really very high. So it is 7 years imprisonment and 100,000 Indian rupees as fine. So that's the law which is there. So we are thinking that once you have the vendor licensing, then it would be easier to make ensure compliance of these laws. The food safety law also requires that you should not mix tobacco and nicotine in any food product. So that's another compliance that all the shopkeepers will have to do. So in doing that, so drafting the legislation for it at the municipal, at the local self-government level, at the state level, and even after that, preparing the guidelines and the protocols for all these to be adopted and implemented at the grassroots level. Yesterday only I was doing an affidavit for one of the states where they are going to ask, put up an affidavit which all the vendors who are going to get a tobacco license will have to sign it before a court and then present it to the administrator that we solemnly affirm that we will comply with these conditions given in the vendor licensing. So I think these have come. We have been able to actively and effectively use law as means, as an instrument to advance public health. And thanks to McCabe Centre for giving us those support. And I have been getting experiences from other states or other countries through our McCabe alumni. And also, we could approach the McCabe Centre for any legal assistance that was required at any point of time, especially on plain packaging. no, and also the Victoria Cancer Council. I know Kylie there. No, she has been really done a lot of work on plain packaging. I also approached her for food related regulations and the surrogate advertising bit. Oh, that's another big problem in India, that the tobacco industry does a lot of surrogate advertising. Again, when I said tobacco industry, I think that is equally true for alcohol industry. They do a lot of surrogate advertisement because the direct advertisement is not allowed. So, but then these regulations and support on legal issues are very helpful to advance tobacco control and overall NCD prevention and control. Thank you so much, Heli. Any questions?
Thank you, Amit. And I think it's really interesting that you've drawn out some of the areas where the work that on tobacco control also has relevance for other sectors. And hopefully we can talk more about that a little bit later on. But now I'd like to turn to Dr. Onzivu and ask him to explain more about work at WHO's regional office in Africa on supporting legal capacity for NCD prevention, and what are the major challenges that you see on the ground in your work?
Yeah, we definitely have a number of challenges. As you know, at the regional office, we review legislation, we provide comments, we draft languages, and that extends from tobacco to the other areas. And we help countries to train them to build their capacity and to respond directly to questions of a legal nature in the development of legislation, both primary and secondary. And so in that context, that the capacity is limited, especially when it comes to expertise on very key thematic areas, law and NCDs and some of the intersections in between. And additional to that, I think evidence is always evolving, and sometimes keeping tab and keeping pace with the evidence is not always possible, especially with the country. So they need our support for that, and we try our best to do that. And of course, the lack of laws or the weak laws, especially more on alcohol and food regulation and other areas, physical activity. Tobacco has kind of improved a little bit in the region. For example, in the last year, we had legislation in Botswana and recently in Mauritius. And so you see that there is visible progress. But in the other areas, we feel that there is a lacuna that needs to be addressed. And of course, the laws that have been adopted in tobacco and other areas also face enforcement and compliance challenges, and laws are adopted, but then when you really critically go to the ground, you find enforcement is not optimum or lacking. So those are really challenges. And also the challenge of industry capture by the industry. Tobacco continues, but also the food and alcohol industries and all of these other industries, I think they are very vigilant in interfering with the policy-making process, a lot through the other sectors, because they are constituents that inhabit the consultative process of those ministries. And so these are just some of the challenges I can mention for now. Thank you.
Thank you so much, William. And if I could ask you one more question, if you could just explain a little bit more about how the McCabe Centre has assisted you in building legal capacity for NCD prevention.
I must say that McCabe Centre has really supported the region generally and the countries specifically. All of the trained cadre of lawyers have gone on to promote public health, but also specifically NCD prevention by reviewing and drafting legislation. Quite often when we get requests from countries, they are the point of contact we also refer to, so that they know that there is a request and they are able to contribute. And a lot of time, these are the lawyers who have been very critical in drafting bills, in advising at the initial stages and following that through towards adoption. And so we've been very grateful for that. The industry legal actions in our region have been quite pronounced, as you know, Kenya, Uganda. Of course, the threats of legal action have been in many of our countries, and these trained lawyers have really stepped in to support these cases and successfully actually defended laws adopted by our member states in Kenya and Uganda, and also advised on impeding industry threats as well. But of course, they've also provided policy advice and legal advice, and those advisory notes and briefs that they contribute to, I think, have been very critical in supporting the adoption of laws in NCD and other areas of public health as well. And in the region, we do conduct both national, sub-regional, and regional training and capacity building for both legal and non-legal staff. And we've been lucky to have a team of alumni from McCabe that we draw on, at least 1 or 2, to join us to conduct these workshops. And I know previously we used to, even appreciate McCabe sending a team to Africa so that they could join, their staff could join in. And I think that has not been obviously possible, COVID and others. And we just hope that that will be for the future. I just must add that in the region now, post-COVID, it's a demand from the countries that now we have to meet face-to-face. We used to focus on virtual work during the COVID, but now we are being basically directed from the countries that they are not, they don't feel that virtual work is sufficient. And so we have actually started working in the countries, conducting workshops. We were in Zambia, we were in Sierra Leone recently, and even Gambia too. And we have a number of other activities. And of course, for this, we will still need the McCabe alumni to join us to conduct these trainings, because they're very critical in promoting and advancing legal aspects of NCD prevention in our countries and beyond in other public health areas where we work. Thank you.
Thank you, William. And that's really interesting to hear that there's such strong interest in in-person activities now. And having recently travelled myself, I really remember and know the benefit of seeing people in person and being able to re-engage with those personal connections. So that's interesting to hear that that's happening already in Africa. Now, we did promise that there'd be an option for audience participation. There's a lot going on in this session. So we do have a Mentimeter poll question that we would pose to our audience. So if you'd like to participate, we've got a question which is, we'd really like to hear from you as to what cancer prevention and control areas require the most urgent legal reform in your country. So the code to access that Mentimeter poll is 46501580. So if you go to menti.com, you can enter your response, and we'll be really interested to see what those responses are. So we'll leave that up for a moment so that you can have a chance to log into that. But in the meantime, I'd like to call upon our fantastic alumna from Papua New Guinea, Vicky Wari, and ask Vicky, could you share a key learning from the McCabe Centre International Legal Training Program and how you've applied that in your efforts to progress cancer and NCD prevention and control in PNG?
Thank you, Halle. As I introduce myself, I mentioned that I'm a health professional. I provide technical advice to addressing non-communicable diseases. But when it comes to law, this is an area that I have not much knowledge about. But as I have been working through with the lawyers, especially on the tobacco law, I have been like learning as I went along. When I attended McCabe in 2015, within that cohort, I had 2 other lawyers from the department that I am working, the health department. We all attended together. And so during that time, we're able to share about, and for me especially, I have to ask a lot of questions to know about law, how to draft the law and all this. But one thing that really impressed me and what I learned and what gave me the confidence during that time was the plain packaging experience which Australia went through. At that time we had a law which prescribed the packaging, the health warning around 30% and then to 50%. And when I had this, I was like, oh, we can increase the health warning on the packets to more than 50%. And at the same time, learning about the graphical health warning on the packets really gave me the confidence to look at the law and look at how best we can, how do we advocate on the harms of tobacco just by packaging using the graphical health warnings. So that was one thing that gave me the confidence when I attended the McCabe Centre for Cancer and Law. The other thing I learned during the cohort was the trade law. You know, many a times, even before attending McCabe, we had an argument with one of the industries in the country when we were doing the tobacco control law. And the argument was over the trade agreement. Okay, we are member to the WTO, and if our law on the tobacco control is, it's contradicting the agreement, or it doesn't comply to the agreement under the WTO, then we can face, we can face, we can be challenged in court for that. But during that time, I was, grateful to have attended a meeting and learned that there are provisions within the WTO that provides for, public health intervention, that gives the prominence, and that when we draft laws, when we look at the laws, it helps, it define, and we can be able to, challenge this and give prominence to public health interventions to prevent disease, especially cancers and other non-communicable disease. So this was one thing that I learned from McCabe Centre, especially for the tobacco control. With that same concept, I am now asked to also look at the alcohol control law in the country. And I already have the confidence in working with a team, especially with the the alcohol control law. And at the same time, we are now going into looking at the food policy. And one of the things we are doing now is to have some research around food policy and the imported goods into the country. So with the training that I have gone through, it gives me the confidence to really look at all the laws that are addressing non-communicable diseases and cancers. But one of the challenges that I faced in the country is human resources. One thing, human resource, because I am the only one within the program. I have 2 lawyers there, but unfortunately, that's not enough for us. There's a lot of areas that need legal advice and all this, and sometimes lawyers don't get to have the time to really look at this. And the other thing that we are always being challenged is we have to provide evidence to support the law that we are drafting. So these are the 2 basic challenges that we are faced now in the country. And this is one area. As a researcher, I'm also looking at how best we can look at conducting research surveys to have evidence to argue our case and to get our laws up to address non-communicable diseases and cancers. Thank you.
Thank you so much, Vicky. And I think it's really important, the point you mentioned around increasing familiarity with these legal concepts for non-lawyers, and your extensive experience from the health sector and how you're now working with lawyers within your team so effectively. That's really fantastic to hear, and I think we need more of that collaboration across different sectors to really see this change. I think we've got some results from our Mentimeter poll, so I might ask Alessandro and Sinead to share those if we've got those available. So we asked which cancer prevention and control areas require the most urgent legal reform in your country. Oh, we've still got some results coming in. And we've got a pretty mixed, fairly even responses, with a strong response for tobacco control and universal health coverage, 12% for alcohol control, 18% on food policy, 6% on access to medicines, and 18% on pollution. So Yeah, obviously there's a lot of work to be done. Luckily, we're all ready to pitch in and to help do that. So thanks very much for contributing to that poll. Now, I'd like to turn to my colleague, Evita Ricafort, who's our regional manager for the Asia region. And Evita, I'd like to know more. You support alumni throughout Asia in progressing law reform aimed at NCD prevention and in defending laws. What have been some significant developments that you've seen over the past 10 years in your work?
Well, all of us on the panel here have been in tobacco control for a long time, as well as some of the alumni who are present on this call. So what easily comes to mind is the many achievements in tobacco control that the McCabe Centre's alumni have worked so hard on over the years. And please forgive me if I might be putting your country on the spot, because I just I feel very proud to be able to share with everyone that I know our alumni from Bangladesh, for example, has helped to establish the National Tobacco Control Cell in Bangladesh. Our alumnus from Nepal has been working on plain packaging legislation for Nepal, and Nepal has been very progressive. They already have some of the world's largest graphic health warnings on tobacco product packaging and labeling. So that is very significant. We have alumni from Thailand and Malaysia working on their plain packaging as well. We have Sri Lanka winning in lawsuits lodged against their graphic health warning laws. Very recently in the Philippines, we won our first ever legal victory in the courts in any tobacco litigation here. And that is saying a lot, because there are dozens of cases that have been filed by the government, against the government, by the tobacco industry. And it's only a few weeks ago that we got word that the Supreme Court had overturned a trial court decision that had initially adjudged FDA regulations on tobacco control as unconstitutional and illegal for allegedly being in excess of the Department of Health's powers. But the Supreme Court recently held that clearly the DOH, the Department of Health, and the Philippines Food and Drug Administration have regulatory power over tobacco products and all products that may have an effect on health. And it took 10 years to get the Supreme Court to do that, but it happened with the help of civil society supporting the government and getting public health champions to intervene in the case. So now I'm pretty excited to see how the Philippine FDA can finally regulate tobacco unhampered by that case. But I think I'd also like to take this opportunity to highlight some significant developments in the non-tobacco risk factors for NCDs that do not get as much attention. In alcohol control, for example, we had an alumnus who was working on a bill on alcohol control at that time when he joined in 2018. And back then, there was no comprehensive law on alcohol control in Vietnam. But in 2019, Vietnam had been able to pass the law for the prevention and control of alcohol-related harm. And by 2020, that law had taken effect in Vietnam, which included restrictions on marketing and multimedia, such as restrictions on TV advertisements, restrictions on where they can sell alcohol. There was a ban on selling alcohol near health facilities in schools. It included a drink driving policy. It included increasing excise taxes on alcohol. And that is quite outstanding to be able to do all of that just through one law, one piece of legislation. I'm from the Philippines, and like Vicky from Papua New Guinea, we do not have this comprehensive alcohol control law yet, except for the law on drink driving that we do have. But even that is fraught with challenges when it comes to enforcement and resources and capacity. So I see that Vietnam experience as an excellent example of what can be achieved by governments at a very low cost and very effectively to prevent NCDs and cancer just through one piece of legislation.
That's wonderful. Thank you, Evita, and wonderful to hear all of those developments around Asia and beyond. Now, we did promise that there'd be some time for questions from the audience. So I'd like to open that up now. If anybody would like to raise their hand to pose a question to our fantastic panel, please feel free to do so. I've certainly got a lot more questions for our panelists, but would like to give you all the opportunity to ask questions. So I can see there's one question here from Dr. Wasim from Pakistan. Is there a mechanism at McCabe to support the countries where you do not have alumni? That's a good question. We do sometimes take queries via the WHO Framework Convention on Tobacco Control Convention Secretariat that get channeled through to us on tobacco-related issues. Evita, would you also like to respond on that question?
Oh, sorry, I was on mute. Yes, we do have, while there are certain regions where there is a higher level of alumni engagement with the McCabe Centre, we are able to help out in other countries where there is not, where we have not had alumni yet in our training programs, primarily through the WHO regional offices and through the WHO country offices. So please just feel free to reach out to your WHO country office, and I'm sure they will be happy to get to connect you with us. And I'd like to mention as well that the McCabe Centre is a WHO FCTC, Framework Convention on Tobacco Control Knowledge Hub, on legal challenges to FCTC implementation. So you can also connect with us through the WHO FCTC Secretariat. And the WHO is also, the McCabe Centre is also a WHO collaborating center on law and non-communicable disease under the Western Pacific Regional Office. So that is also one way for you to get in touch with the McCabe Centre.
Fantastic. Thank you, Evita. And I was going to mention at the end, but we will shortly be opening, well, we've just opened nominations for our next training program for government officials from low and middle income countries primarily. So we can certainly pass on details about that training, and would welcome registrations from a wide range of countries for people who'd like to participate. I can see there's a similar question around the opportunity to expand in Africa. Evita, would you like to respond on that one?
Yes, well, as Haley had mentioned, we are about to have the 2022 edition of our International Legal Training Program, our online legal training course. And we would be very happy to have participants from Africa join us. So please do connect with the WHO point of contact in your region to be able to participate in the nomination process for the online legal training program.
Fantastic, thank you. There's probably some more questions coming through, but I've still got a couple of questions for the panel. And I'd like to ask Amit, you've got such extensive experience working in tobacco control at so many different levels, from international, regional and domestic. How can alumni from government and CSOs working at the national really maximise those regional and international links?
Yeah, thank you for that question, and I think that is linked to the two previous questions that has been there. I think in India we are trying to do that, and it would be really good to have alumni come together. Our last alumni workshop, ILT alumni workshop in Melbourne in 2018 was a great experience sharing and learning from each other. And I think if we could also have something like that for the national level or at the regional level, and I know like Evita keeps in touch with all the alumni in Asia, so we could have a calendar event for alumni of Asia, or let's say for India. So a couple of alumni from India could be coordinating with the others, and they can work together on advancing not only, let's say we are working in tobacco control, but not only in tobacco control, but other NCD prevention and control. So that would be really helpful. I think this has already been there. I'm not sure if we can have a dedicated portal, but I think having a Facebook page of the McCabe alumni would be a good way of interacting with each other or posing questions for suggestions from the alumni. So that would be another good way of making use of the expertise that is available. I have met a couple of alumni from India, and we have been working with each other. One from the director at the Ministry of Health, and other colleagues who are working in tobacco control and NCD prevention and control, who have been part of the McCabe workshops. So I think that is a very helpful thing. But I think to institutionalize that, if we can have a coordinated mechanism from the center, I think that would be really helpful.
Fantastic. Those are great ideas. Thanks, Amit. And in a moment, we're going to show you a special graphic design which has been underway. You might have seen Glenn Stevenson working steadily there in the background, scribing our session in a slightly different way and putting some visual elements to some of the discussion today. So I'll pass to Glenn in just a moment. But before I do that, I wanted to go back to Vicky and just ask Vicky if you've got any examples of how you've worked regionally or how you've drawn on support through the regional network in progressing NCD prevention and control laws through your work.
Thank you for the question, Helen. I have the Pacific coordinator, which is Diana. I communicate with her in terms of legal assistance, and at the same time, I have the WHO office, which I also consulted in terms of drafting the law. So we have the country office as well as the regional office, and they provide the support, the legal support to us in drafting our tobacco control law. And the same advice goes to alcohol control law. We are also working with them. In the Pacific, we also have the Secretariat of the Pacific Community, who also provides some technical assistance in terms of policy and law development. And DAI in Suva office is also attached with them, that they're working in collaboration together and are able to provide the advice to the country. So that's how we also network with them and be able to get the advice we need from them or the assistance we need from them.
Fantastic. That's great to hear that you're getting support regionally. And I know that our regional manager for the Pacific, Diana Borisova, has some fantastic support that she provides across that network. Thank you, Vicky. Okay, I might ask Glenn to share his drawing of what he's done so far from the discussion today, because we've only got a couple of minutes left. But this is a visual representation of some of the discussion that we've heard about this evening. Wow, that's fantastic. Really fantastic to see some of these ideas represented in a visual way, and we'll be sending a copy of this out after the session so that everyone can have a look at this. But as lawyers, we get very stuck on looking at text and dissecting legislation, so it's fantastic to have that creative mind listening to what we're talking about today and providing us with a different angle on looking at using law for cancer prevention and control. Well, we've only got 2 minutes left. The time has really flown, and I would like to really thank all of our fantastic panelists, Amit, William, Vicky, and of course, Evita, all of the support from behind the scenes from UICC and from Alessandro and Kirsty for kindly introducing us and setting up this session today. Big thank you to Glenn for this wonderful visual representation of what we've discussed. And a big thanks to everybody for participating in the discussion tonight. I feel like we could have gone on for several more hours, but it is always good to finish while everybody is wanting more. So before we finish, I do just want to mention that there are some further resources for people who are interested in progressing law for cancer prevention and control. Some of you are already very familiar with these and are part of our networks, but many of you are new, and it's fantastic that you've joined us tonight. So as I mentioned, our online legal training course for government lawyers and policymakers has just opened for registrations for the next month. So do feel free to have a look at the details for that. You can email iltp@mccabecentre.org for more details. We can send you out the information pack, and you can see whether that's appropriate for yourself or your colleagues. Some of you might be currently taking the McCabe Centre UICC Master Course on the UICC platform, which is targeted at civil society and UICC members. That course we're up to module 4. We've got one more module to go. But once that course is completed, it will be available on demand as well in a couple of months' time. So for UICC members, do keep your eyes peeled, and UICC will circulate details of all of the courses that it makes available on demand. Of course, there's further resources on the McCabe Centre's website, and that includes a link to our Knowledge Hub, which has more specific technical resources on the Framework Convention on Tobacco Control legal challenges. And if you'd like to subscribe to our newsletter, there's a long link there, and we can also put that into the chat. But fantastic to have everyone joining us today. Thank you once again. A big thank you to our panelists and to the incredible McCabe Centre team as well, and all of our regional managers based in Kenya, in the Philippines, in the Fiji, and also to our strategic advisor based in New Zealand. So that's all from us today. Thank you all for joining, and I hope you can keep continuing your efforts to use law to progress cancer prevention and control in your own countries. Thank you so much.
Thank you. Thank you, everyone.
Thank you, everyone.